Hello everyone and welcome to my show. I'm Melody Trice and I'm so excited that you decided to watch the show today. You know I'm all about life unlimited. And you know, one of the things that be limiting us is when we get in an accident or something happen to injure our body. And we only get one body, right? So we want to make sure that we take care of that body. That's why I have an amazing guest today, going to tell us how you should be, making sure that you get the right adjustments so that your body function the way it's supposed to be. Because we don't want no limits, right? We want to make sure that those limits are off of us so we can live the life that we were called to do. And that's living life unlimited. So I want you all to stay tuned because up next is Dr. John, all the way from Duarte, California. And we'll be right back.
I know it may seem like your life is falling apart, but don't quit now, here comes your second wind. I am here to uplift our young ladies that want to give up on life, to let them know that God has a plan for you. Please join our efforts as we all can uplift our young ladies and together save our daughters against homelessness. We love you. Don't quit, baby.
Welcome back, everyone. If you're just now tuning in, you're in for a treat. We want to welcome my special guest. Welcome Dr. John to the show.
How you doing?
I'm doing great. Good to have you here.
Thank you very much.
So tell us about what you do in particular.
Well, first of all, I'm a doctor of chiropractic, so I treat patients. It's a spine-based discipline. However, we do work different parts of the body depending on what's going on. If you have injuries, things like that, it doesn't always have to be the back, the head or the neck. It can also be extremities, things like that.
So what made you get into that particular field?
Well, I was in business school and they said, narrow down what you wanted to do in life, and chiropractic was one of the top things, and went and did a job shadowing with a friend of mine. And in the process of doing that, I kind of went and sat in the waiting room and like everyone else and looked like I was regular, patient. And I listened to what everyone had to say, and they had a lot of wonderful things you're saying about what this guy was doing and how he changed their life. It's like, all right, well, that's it. My list of 6 just went down to 1, and that was it.
Wow.
Rolled into school, and the rest is history.
Wow. Well, you know what? I've been to your office, and everybody that comes in there say a lot of good things about Dr. John.
Glad to hear.
So tell us this, and I know I'm just diving right deep into it, but one of the things that have been the most challenging for you as a chiropractor?
Well, you'll get a lot of complex cases. I've had post-surgical patients. I've had, your run-of-the-mill. Everyone's got a little kids falling and breaking bones. I've had several different issues ranging from minor injuries to more severe injuries, things like that. So, we do a workup as soon as someone comes in to see the severity of it all and see what's going on.
So you work on kids as well?
Oh, yeah. So youngest I've had as a patient was about 2 months premature.
Really?
I've had as old as 98 years old, so I've had a full gambit. It is a family practice, like it is, like the name says.
That's amazing. So how did you manage that to work on a 2-month-old baby?
Well, lots of practice.
Wow.
But ideally, what happens with that? You're working on smaller skeletal system, obviously. So things are different. You palpate and see what's going on, and a lot of times babies will respond a little differently, obviously, than adults.
So the adults
there are levels of communication. Adults will cry, babies cry too, but a little differently.
Oh.
So a lot of times you'll try to initiate a response with them mostly. So touching different parts of their body. If there's soreness or pain somewhere, they'll kind of respond to it. And in the process of doing that, you kind of figure out what's going on and treat accordingly.
Wow. So what would you say to someone who's actually in that pain and has been dealing with that pain for a while?
Well, that's where you do when someone comes in, you do the initial workup to see what's going on. You come in, you do vitals, things like that. You do a case history, social, skill, whatever's going on with them, and just go from the get-go and see what's going on. If there's a history of it, if there's a reoccurring injury, maybe there's something going on that you need to investigate more thoroughly. So X-rays and MRI are pretty routine. So we get that a lot of the time, and that helps. Because I've had patients come in, you ask them what's going on, and they're like, oh, nothing, I'm fine, everything's good. And then, you find out, you take an X-ray and the spine goes up and then up to the right about 20 degrees, and you're like, well, your spine was broken sometime in your life, what's happening?
Wow.
And she proceeded to tell me that she'd fallen and had to get heliported off a hill or something like that. So history is obviously important. You come in, someone says they have a crooked spine, they might literally have a crooked spine.
Wow. So when they, if they're young and they don't take care of those injuries, even if they're not young, if they don't take care of those injuries right at the beginning, how do that impact their life as they go?
It can be a progressive thing. I mean, a lot of times you'll have kids, you know, and you have injuries as children, and it'll progressively get, you know, worse over time. You know, it's almost a cumulative thing. People have recurring injuries. Usually it'll happen more frequently as you go on if it goes untreated. As you know, I mean, a lot of times if you have a minor injury, if you don't address it right away, it may be a bit of time before, you know, it'll get progressively worse, and then it'll, you know, as you get older and less active, which I think is a primary thing, it, you know, manifests itself as scar tissue, and that gets progressively, you know, more and more painful and less, you know, useful, and you'll eventually either seek some form of treatment or have to take off work, or something will happen to a point where you have to address it.
Wow, that's deep. Because what you're saying is, if you don't treat it, it's just going to make something else worse.
Potentially.
You know, even if it wasn't the part that got damaged, right?
Potentially. So what will happen to, you know, you'll compensate a lot. The body's able to compensate for a lot of different things. I mean, it's, you know, the reason we survived this long, well, you know, with our existing structures, is its ability to adapt to outside and, you know, or even internal forces. So a lot of things that happen. I mean, your body will definitely compensate about as much as it can, and then things start happening, and that's usually when, you know, pain receptors, which are very small percentage of your nerve endings, are, you know, will bring someone to the office or somewhere where they think they need help.
Wow. So when someone come to you, and I know you have some amazing help there, and you say it's a family practice?
Yes, ma'am.
You and who else?
My wife.
Awesome. What's her name? So we make sure we give her a shout out.
Maggie Possession.
Maggie Possession.
Yes.
Well, you know what? After this message, I definitely want to talk more about the different things that you offer, because I know you offer more than just chiropractic there, right?
Yes,
because I know they got some great massages going on, some deep tissue that, you know, I ain't going to say it's, you know, but it works.
Yeah,
right. It works.
It's not your usual
massage.
Yes.
Your honey poo massage, just not a honey poo massage.
No.
No honey poo massage.
No.
So y'all, after this message, we'll be right back with more with Dr. John from Duarte, California. That's amazing. See?
Do a lot of different things with BOSU for balancing. If there's lower body or upper body issues, you can actually do coordinating balance and a sport-specific exercise. So a lot of different things and variables you could actually introduce and make it more complicated by either doing multi-planar exercises and or incorporating balance into it. Woo.
I know it may seem like your life is falling apart, but don't quit now, here comes your second wind. I am here to uplift our young ladies that want to give up on life, to let them know that God has a plan for you. Please join our efforts as we all can uplift our young ladies and together save our daughters against homelessness. We love you. Don't quit, baby.
Welcome back, everyone. I have with me Dr. John from Duarte, California. I can't even get it out. It's such a big old word, right? But look, I am so excited for you being here, and I know that you just said before we went to our break about the fact that you have a family practice.
Yes.
Tell us a little bit about the different things that you have there.
Well, you know, like I said, it's not specific to pediatrics or sport injuries or things like that. I do have background in sports medicine, so I did a postdoctorate cert in that. So we do treat quite a few athletes as well. So, you know, being that there's no age-specific group, we kind of deemed, and especially, you know, since my wife and I both own the practice, it is called family practice. But we, you know, we have geriatric, you know, I don't know if I should call them geriatrics,
what is
but
that?
I have senior citizens.
Oh.
So I have, you know, retired age people that come in, and, you know, I have them do activities and things like that. You know, it helps out considerably.
Do you also do, is chiropractic the same as physical therapy?
There are a lot of similarities, a lot of overlap, and there are a lot of differences. I mean, they tend to cater more to doing exercise rehabilitation as their primary. We tend to try to work on the spine to make sure it's aligned properly. So everything is more of an alignment. You can compare one side to the other. So you do range of motion assessments for, you know, extremities, lower back, upper back. So when someone comes in, we do an exam. You know, you do the vitals, things like that. And first thing I'm going to do is ask you what's going on. You know, area of complaint. So we're going to go from there. Then I'm going to check the range of motion. So if there are any asymmetries, there's a chart you use what figures out what's going to be your usual range of motion. If you have limited range of motion in one direction or another, then we kind of address that.
Wow.
Yeah.
Because you know what, I guess that's why they have that picture there, because a lot of us wouldn't know what those words mean, but we know what that picture means.
Right. Well, I didn't used to know what they meant.
Oh, but see, that's why you're a professional.
So, but I mean, it's a lot of the different things we have to go into is in treating that is, the case history is going to tell us pretty much everything what we need to do with that. I mean, some of the exercise, rehabilitation we do, which you've seen, everyone's going to do something. And I mean, most of the time I'm in some type of workout equipment or clothing because I'm doing a portion of the exercises. Wow. So, depending on the level that they're at, we're talking about the seniors. I have them doing certain types. I have kids doing certain types of exercises as well. Also have a trainer that helps out with some of that.
So you have personal trainers there?
Yes, there's a trainer that helps out, helps us quite a bit.
So even if they don't have an injury, can they still come for that?
Of course.
For weight loss management or anything?
There are a lot of different things that, like I said, there's not always the pain receptors are usually what bring people in, but there's always something. There could be something that you've had that you may never know. Had a person in this morning, and I'm looking at the bottom of the shoes, and I'm like, dude, you're obviously not walking properly. Something's going on there. So you need to, address that. Even though it's asymptomatic, it's going to eventually, cause problems.
Wow.
So
that can cause a problem by just the way you walking?
Absolutely.
Wow.
Absolutely.
Is it the shoe or what? Or just the way you walk?
It could be several different things. I mean, if your pelvis is off alignment, it can actually, it kind of moves like that. If one moves back like that, it'll actually draw that leg a little shorter. So functionally, you'll have one leg a little shorter. And then getting back to what I was saying was compensation, your body will try to compensate for that by either rotating the foot outward or inward or something like that. So
I met someone that had a drop foot. What is that called?
Drop foot.
It looked like, well, that's what I call it. It may not have been that, but they feet like it was dead, and it was like
they have no motor control over it.
Yeah, it
mainly
just
that particular nerve root has, not conducting properly, so that muscle's not functioning. Your brain is not telling that muscle what to do properly. So there's something going on along the nerve network there. More times than not, it's up near the central nervous system or the spinal cord, and it's not happening anywhere distal to there. And most of the time, that's going to correlate with a specific segment in your lower back.
Wow. So even though you're thinking it's one thing, it's actually coming from something else.
Yes.
Oh, wow. That's amazing. It's almost
all
like
connected. So.
You know how you have a flat roof and you thinking the leak is one place and it's completely somewhere else?
Well, I guess, yes.
Wow. See, that lets you know. See,
so
how I had to think of is a roof leaking.
Right.
So tell us this, do you also have, when they come in, what are some of the steps that a person can take to recovery?
Recovery from an injury?
From an injury or, injury.
Okay. Well, initially you want to see what's going on because, I've had to refer out depending on the situation. I've had surgical cases that I was like, the only thing that's going to help you is, you need to have surgery because the damage is so severe that's, you had limited options at that moment, point in time. You can still do some level of corrective exercises, but ultimately, if it's that bad mechanically, it's, nothing's going to really help that except surgical intervention.
Wow. Do everybody recover from the surgery? So say, for instance, a person have back surgery, do they still go to a chiropractor or
they can.
Or do they go straight to a physical therapy?
You can do physical therapy, you can do chiropractic, you can do both.
Oh, you can do both?
They've had the best results when there's been an intervention from different disciplines. You go see a dentist is going to tell you, you need work on your teeth. The surgeon's going to do surgery. Physical therapist is going to do strength and conditioning. Chiropractor is going to realign the spine. So we're always going to have a certain angle that, to get the end result. So we've all kind of worked in this syncytium and it's helped out. So
let me ask you this question. Do weight play a big part on the
I have some theories behind that, but ultimately when you're talking about a lot of weight, it's not so much the weight itself as whatever this frame can withstand. Because I've had 110-pound people that can't hold their weight, and I've had 320-pound people who are fine. So it's not so much that, you get on the scale, if you use a scale to dictate your life, you're going to have a really difficult time. It's going to be really stressful for you. So it's not so much that, it's what your frame can withstand. So if you're suffering from knee pain or things like that from doing normal, regular activities of daily living, then maybe you need to work on either one, strengthening, or two, losing a little bit of weight. So weights, the BMIs and things like that aren't really that
Okay, I was
as
thinking
important,
maybe.
but it does have some input on
Okay.
what's happening.
Because I was wondering, I didn't know, like, do that impact you of recovery?
Well, yes and no. I mean, a lot of it's conditioning because, I mean, like I said, the weight's not as much. Depends on what the frame can withstand. Up. Your muscles, the muscles in your structure, your core, and things like that throughout your body are able to withstand it. It's a lot easier. Prognosis is going to be a lot better, long term. Sedentary lifestyles are going to, probably the number one cause of, problems nowadays.
Oh.
People sit, computers, keyboards, things like that are that's keyboard, right?
Yeah, so if you on your
Not
phone,
piano,
if
but
you on
yeah.
your phone like this
Yes,
actually can cause problems.
Well, that's a whole different show in and of itself talking about that. I mean, that's ergonomics. Well, is a big thing too.
What you call it? So you said
Ergonomics. So ergonomics ideally is how your body is positioned throughout the day. So a lot of times if you're in forward flex position, especially if you're looking down like that, it's not the best thing for your neck. And if you go an inch or two forward or anterior, you're putting an additional 20 pounds of stress on your spine.
Oh, really?
So yeah, so it's pretty significant.
So technically,
over time.
we need to hold it up.
Everything should be at eye level.
Oh,
should we say?
like this?
Yes.
Oh, wow.
Yeah, I know. You don't see many people doing that, but that's
No.
a situation that gives you put your spine in the best position.
Wow. And so when a person's spine is crooked like that, can it be just snapped back into or
Depends
do it
on
take
the situation.
time?
I mean, you had people with things like scoliosis and things like that. I mean, that can be managed. You're going to do some level of traction or something like that to remedy the situation. But ideally, once they hit a certain age, it's very limited as to how much you're going to be able to correct. So there's certain things you're going to look for. Whenever you have an adolescent, more times than not, it's females with scoliosis. Some
really?
men, but more females.
So what scoliosis, is that like Moso's scoliosis? Is that the same thing?
It's the spine itself. Normally, if you're looking at someone straight on like that, the spine should be relatively straight. But if their spine is kind of going left or right like that, if it's a lesser degree, it's lateral curvature. If it's over 30 degrees, it's considered scoliosis. So with that said, there'll be a higher part on the right side that you have to work
I've seen
on.
that.
Yeah, so
that's what
that's
that
the area.
is.
So with traction, you can minimize that and work on the muscles and structures, things like that, and that'll help it out. But ultimately, once you're at a certain age, and there are certain signs and things you look at, growth plates, things like that on younger, girls or boys too. But you're looking to see if those growth plates have sealed. Once the growth plates have sealed, there's very limited amount of influence you're going to have on that part of the spine.
So tell me this, when people are crooked over when they get older,
Yes.
and it looks like they got shorter, and then it's like, I'm just being real, it's like a hump. You know what I'm saying?
It's actually called a hump.
Oh,
some
is
of
it?
it, yes, it is.
Oh, it's
so
called that. Oh,
some
my
of that
God.
could be from another situation. That could be from having osteoporosis, things like that, some type of a fracture. Mainly, what's usually happening in that situation is the front part of the vertebrae is starting to crush a little bit over time, and it gets progressively worse because the front part has more force on it than the back, so it kind of becomes a wedge. And then you do that incrementally, and then eventually you have a forward flexion.
Wow.
Yeah.
Because I seen that, and I said, me don't want that.
I hear you. Well, it gets into doing things too. I mean, you're talking about exercise, and we can go over that too. But you want to strengthen the spine and also the musculature, and that's going to definitely help you out.
So they can tell that when they're younger before they get older, and actually the hump come, or that just something.
It's usually a gradual onset. It doesn't happen right away.
But when they notice it, they can't like.
They do, but I mean, I think it's once you're already down that path, it's already starting to build momentum, and then it's a little bit harder to work with. So there's some other medical significance to that too. I mean, most of my approach to that is you're trying to minimize that because you're also putting pressure on your vital organs. I mean, think about being forward like that. You can't breathe properly. You can't, take a deep breath. Lots of different things.
And I always thought maybe that was something with the bone, and they just need to take like more calcium.
Yes and no.
Yes and no.
Yes and no. I mean, you can't sit there and not stress the bones with some type of, like I said, weight-bearing exercise and just take calcium. It's not going to work.
Oh.
So you can, if you have a deficiency in calcium, it's something that you need to discuss with your primary doctor. They probably should do some level of blood work or something like that to make sure that's not an issue, and then go from there. But ideally, the calcium in and of itself is not going to help.
Oh, because it's already like going
You
down.
can put fuel in there, but I mean, it's as limited as the functionality.
Wow, that's deep. Well, you know what? I want to know where people can stay in contact with you so they can, keep following you and checking you out and all that good stuff. So let the world know.
Right. It's DuarteChiropractic.com is my website. So that's probably the best way of doing it. We're 924 Buena Vista St in Duarte, California.
Oh.
So we're open about 6 days a week. Tuesdays, Thursdays, I take appointments too, but most of the time, Monday, Wednesday, Friday, and Saturdays.
Wonderful. Definitely. So I want you all to just make sure you keep following him and checking him out, especially if you got any type of stuff going on, because we got to make sure we unlimited, because we don't need no type of limits. That's why I make sure that I go to him. And we're going to throw a clip in there so you can see what actually go on in his doctor's office. So till next time, I'm your girl, Melody. Make sure you follow me on all my social media and check out my YouTube channel as well. And till next time, I'm your girl, Melody. Bye. Get well, get well, get well. Thank you so much.
How we doing?
Can you explain what you just did?
Oh, I'm explaining. So mainly had a bit of an injury there, so I'm kind of working on this area. It was upper and middle and lower back. He's got a little bit of limited range of motion and some restrictions there. Some of it's some scar tissue, post-accident scar tissue that I'm working on. So it tends to be a little sore and things like that. So ideally try to restore range of motion and also give him, so later on down the road he won't have any problems or limited range of motion. I'm at rest. Utilize this exercise to strengthen a lot of the postural muscles. Their shoulder injury we need to work on, and we'll work the shoulders, upper and lower back, and cardio, as you can tell. But it's a good overall exercise when I have someone that's just got an injury. I'm trying to introduce them into doing some rehabilitative exercises. Woo! I had a special ops guy come in one time.
Recording.
I've had people, SWAT members come in, they're obviously the elitist of athletes. I've had some professional athletes come in as well. They're all the same. I mean, you can introduce and cater certain exercises to individuals. I mean, you can have an 80-year-old marathon runner, or you can have a younger 9 or 10-year-old athlete that the skeletal system hasn't fully functioned or developed yet. So you can also introduce things into their regimen that's not going to put too much stress on the long bones. Because growth plates are open, you can still put stress into the body, but you don't want to put too much where you think you may, compromise the development of the skeletal system. So using these here, I can actually work on balancing, but primarily what I do is I'll introduce TRX or these types of exercises into the routine, because you can also stretch and balance and hold yourself and kind of spot yourself without putting too much stress on your body. So one of the primary stretches is I'll have lower body stretches and hip stretches will more or less be the same. Being down nice and low here, holding that position there will counteract having a lot of sedentary activities, sitting down, driving, and or if you're at a workstation that requires you to sit for an extended period of time. A lot of times these